So what is there? And so steroids, as I've hinted at, equals side effects, and so you need the need for an alternative maintenance medication. This is the problem with a chronic disease. You need an alternative maintenance therapy other than steroids, or else you're dealing with the side effects from steroids themselves. And so things like topical steroids, like budesonide, have been used with some success, although not as successful as in eosinophilic esophagitis. And then Dr. Atkins kind of alluded to elemental diets, as have shown to be successful in adults, and kids with eosinophilic esophagitis have also been shown to be successful in eosinophilic gastrointestinal diseases. The caveat being, obviously, these are all case reports, and so it's dependent on it being food allergen driven, which is not always the case. And then there have been some successes with elimination diets, where you eliminate either the most common food allergens or foods to which a patient has noted allergic responses. But again, this is all rare and very small series. And then I did want to spend some time talking about kind of other potential therapies. These have been studied, again, small numbers. There have been failures. They've looked at IgE antibodies, so with the hypothesis that these are allergic disorders, and so they're IgE mediated and IgE driven. They've looked at an antibody to IgE, omalizumab, and they showed that in treatment of a series of patients with eosinophilic gastroenteritis, that blood eosinophilia decreased, but symptoms remained unchanged, and GI eosinophilia on biopsy was largely unchanged. They looked at an IL-5 antibody, and if you remember from Dr. Atkins' slide, IL-5 was the cytokine that drives eosinophil recruitment and eosinophil exit from the bone marrow. And again, blood eosinophilia decreased, and there was modest decrease in tissue eosinophilia, but again, no change in symptoms.